So you've just taken a sleep course. You're ready to grow your sleep offering in your practice. If you're not careful, then sleep will be one of those things on the shelf, just like that implant course you took, just like that intraoral camera or CEREC or whatever else. We don't want that to happen to you, so we want to spend a few minutes on exactly what it is that you need to be able to take that sleep course and make it benefit your practice. Hi, folks. I'm Sean Crabtree. This is my business partner,
Cameron Bailey.
And we want to spend a few minutes with you. This is such a vital topic. Sleep, throw a stat at them real quick.
Oh, there's a lot of stats, but one of the main stats is 20 to 40% of adult Americans that are living in America today have some form of sleep apnea.
That's a huge percentage, and that's probably one of the stats that you heard or have read about that got you to take that sleep course in the first place.
Sleep dentistry is growing like crazy, and it really is, in my opinion, the next big thing in dentistry.
I agree, and Cameron and I are really good at taking this sleep conversation and breaking it down so that your treatment acceptance when it comes to sleep is where it needs to be. We've got some guys that are operating at about a 98, 99% acceptance rate when it comes to sleep. A couple things that I would throw out there, we're kind of doing this off the cuff, but a couple things that I would warn you on. Number one, it's going to become more and more prevalent where Cameron threw out a stat, 20 to 40% of adult population has apnea. My personal belief is that it's much higher than that. I think it's probably closer to around 50%. But like all things, the stats sort of follow the awareness. So I think you're going to see those stats go up as we become more and more aware of that scenario. Treatment acceptance when it comes to sleep, as it becomes more prevalent in the marketplace. I don't know about your area, but in our areas and a lot of the areas where we coach our dentists, the marketing has gone crazy. You're hearing it on the radio. You're seeing it on TV. Sleep is everywhere.
Well, I was talking to a doctor the other day. You have to market it. There's no
right.
If you guys are going to a course right now to learn how to do sleep dentistry and think that you're just going to go back and implement it in your practice automatically, it's not going to happen. You guys are going to have to go out and drive marketing to get patients, whether that be mailers on the radio, however, whatever works for you. I've got an office in Texas that has a great sleep portion of the practice, and they do really well with search engine optimization, right? They're doing a lot on the internet. I have another office that has a radio show. So there's no right or wrong, but you have to make a commitment to marketing sleep.
You've got to drive it. You've got to drive it. There's no doubt about it. And as it becomes more prevalent in the marketplace, as your marketing gets out there, I would submit that the types of calls that you're going to have, and that's the very first thing we want to talk about is the intake call. The types of calls that you're going to have are going to be all over the board. You're going to have the patient who's calling because they've had an apnea appliance, a CPAP or whatever. They're fed up with the mask and all of that. You're going to have somebody who doesn't have an appliance and they realize that they have sleep challenges. Maybe they have, maybe they've not had a sleep study. You're also going to have people who are driven by other forms of marketing. There are many, many, many boil and bite types of scenarios that are being marketed out there. And of course, there's an implant device that you may have heard about that's been marketed out there. So you're going to have people calling from all varying levels of education.
If you've done a good job of creating a referral base, that should make the phone ring as well. If you're out there actively reaching out to sleep doctors in your area and referring them, letting them know, listen, a lot of those guys don't know that necessarily sleep appliances are really out there that are working.
Exactly. And your intake call becomes the most important conversation that we can have, because again, you've got to identify, is this a patient who thinks that they're coming to us because of they've had some a $99 reference online for a boil and bite? Is that why they're calling us? Are they calling us because they're trying to overcome the CPAP appliance? Are they calling us because they're trying to overcome sleep problems and they don't yet have a solution for it? The intake call is the most important piece of getting it set up so that you can help the patient make the best decision to accept the treatment. So you've got to, in the intake call, figure out which of those sort of challenges you're trying to overcome. And simply the best way to do that is to ask open-ended questions, questions that begin with what or how.
Right.
So you're trying to figure out, is this a patient that's trying to overcome, again, a current sleep appliance? Are they coming from a $99 bull and bite scenario?
Are they sick of wearing the CPAP? Can they not wear the CPAP? Or do they not know? Or is their wife just complaining because they're snoring all the time?
And we cover this extensively in our training programs, extensively. We go into days about this conversation, but we want to give you a couple of quick things. The intake call is the most important thing. You've got to ask open-ended questions that begin with what or how. Start globally. Don't start microscopically.
Have a direction.
Start globally.
And have a direction of where you want to go with that call.
A great question to ask on the intake call might be, so what sorts of challenges are you currently having? That'll tell you a lot. Are they calling because I'm tired of this stupid mask and I feel like Darth Vader? Are they calling because my wife, I'm keeping her up all night and she says I'm stopping breathing?
I travel for business and I have to lug this daggum machine around with me everywhere I go.
Or are they calling because, you know what, I saw this $99 situation on the internet. Yeah. You got to ask open-ended questions to figure out what it is that you're up against on the front end.
For me, the thing that I really focus on when I'm coaching someone on how to take a sleep intake call, I really want them to understand where it is that they're trying to go, right? I want to see, what direction are they trying to put this patient through so that they know what questions to ask. 99% of the time out there, when a patient calls the office, the way the call goes is they just ask, okay, great. So who am I speaking with? Okay, awesome. So let's bring you in and let's see what needs to happen, versus making sure I've got all the decision makers there. If they have a bed partner and they're snoring and they're asleep, it doesn't bother them. It bothers the person sleeping with them.
And so you need to be along for that.
You need to get that person there. And a great way to do that is say, do you have a bed partner? Awesome. So you're married. What's your wife's name? Joanne. Oh, so is Joanne going to be able to come with you to the appointment? Because she's going to be able to tell us things that are going on while you're sleeping that you don't even know are happening. The intake call is vital to being able to create
you're trying to qualify.
Trying to qualify the patient, right? You're trying to qualify and get the decision makers there. What's the next step after the intake call, Sean?
Again, we spend a ridiculous amount of time on this in our programs. If you're clear about what it is that you're overcoming and you've brought the patient to the proper realization on the phone, which is how we're coaching that intake call, then when it's time to show up, you've got the spouse and you've got the patient there. Now you want to find out what it is emotionally that's most important to that patient with whatever current challenge they're having. In other words, it could be a CPAP that they're trying to overcome.
Right.
It could be a sleep situation they're trying to overcome, or it could be, whatever the situation is. Find out what's most important to them emotionally and have them connect to that. Maybe they're not sleeping with their spouse and they haven't
done that in years. I mean, maybe they're not getting any special time.
And that could be because of the mask, or it could be because of the sleep, depending on the scenario.
I can't tell you how many times I've heard recordings where it's been that scenario.
Absolutely, time and time again. And we've listened to recordings on this for years and years and years. But having the patient make that connection to what it is that they're missing emotionally by not having a sleep appliance currently. So asking the question, what's most important to you about the fact, and you want to ask it based on what you've learned in the intake call. What's most important to you about not getting sleep, or about not sleeping with your spouse, or about getting rid of that mask, right?
Yeah.
And that's what you're doing chair side.
Yeah.
So you're able to find out, again, what's most important to that patient emotionally, and now you can create value for the appliance.
Yeah, some good examples of that are, if I ask the patient, what's most important to you about your sleep, right? What's the most important thing to you about your sleep? And the patient says, oh, I'd like to get some sleep. You don't just stop there, because getting sleep is not the most important thing, right? We're looking for an emotional standpoint. So getting some sleep because of what? Because I want to be able to spend time with my kids. I don't want to be with my grandkids and be tired all the time. I want to be able to go to work and be able to function and be able to bring my best abilities to work. You know, those are the things that you got to get the patients to say, so that then you can show them how the product that you have will give them those things. That's the most important.
And you have to be able to know what it is that you're trying to overcome. Whether it's the bowl and bite that they're going to have to replace every few months, or the custom fit appliance based on their particular bite, etc.
So the third piece of this that's most important is the financial arrangement. How would you present the financial arrangement? And this is an opportunity that I see all the time that a lot of people don't understand, that in order to sell the case, you have to sell it on emotional value first. If you don't find out,
sell it financially.
If you don't find out what's emotionally most important to the patient about being able to sleep, right? Because again, they don't want sleep. They want what's emotionally attached to that. Spending time with their family, not being tired at work, being able to get in the same bed as their wife, being able to not have to keep their wife awake, right? Those are emotional, or their husband. Those are emotional things. And that's what's going to sell the case, not on money.
The same thing is true if it's not a sleep thing. Connecting them to the emotional value of not having to use a mask and being tied to a hose, or connecting them to the emotional aspects of not having to lug that thing around if that's their deal when they travel a lot, or connecting them to the emotional aspects of not, plowing through these boil and bites every so many weeks and so forth. What Cameron's saying is the key. You can't sell something emotionally with dollars. You have to have it. The value is created emotionally, and then the financial piece is very, very easy. We would challenge you to present that simply in monthly terms. Let them sign their name and take the impression right there. I mean, it's as simple as, walking into the room and saying, the financial coordinator saying, you know what, getting a handoff from the assistant or the hygienist. So Cameron and I here have had a really good conversation. The most important thing to Cameron is that he wants the confidence of knowing that his relationship is not in jeopardy by being able to sleep with his spouse on a regular basis. He's not been able to do that for the last 6 months. They've been sleeping in different rooms. It's causing all kinds of problems in their relationship, and Cameron's ready to get something done about it. The doctor's taking a look. He's a great candidate based on his numbers and so forth for this particular appliance, and Cameron is ready to go. He understands that once he gets this appliance, he's not going to have to worry about sleeping with his spouse on a regular basis. She's not going to have to deal with all of the snoring and the waking up and this, the apneic pieces of it. And Cameron's ready to go. And then the financial is as simple as.
Great, Cameron. Looks like we can do that for $162 a month for 24 months, and that's no interest. Just sign here.
And that's it. That is really it at the end of the day.
I think that a lot of times where I see mistakes in the financial are we make it too difficult. We try to explain too much. We try to show too much. The patient asks us a question, and then you don't know how to overcome the question, right? You answer the question with a question. So let's role play with that a little bit. Give them some meat here. So,
okay.
So great, Sean. Looks like we could do that for $162 a month for 24 months, and that's no interest. Just sign here.
How much does my insurance cover?
Oh, good news. Your insurance is actually going to reimburse you directly. So you can take that money to do with it what you want. That's your money. You can actually pay off your payment plan, or you can go buy a Lazy Boy with it.
So how much is mine out of pocket?
That's everything. $162 a month, no interest, no money down.
How much again?
$162 a month for 24 months, and that's no interest.
Interest-free.
Interest-free.
No interest.
No interest.
All I have to do is sign.
All you have to do is sign your name.
How quick could we get started?
We can get started right now.
Let's do it.
So the key there is putting the responsibility on the patient, right? A lot of you guys that are out there are just going in there with the buffet, like Sean would say, and do you want the green beans, the mashed potatoes? And you're just making it too hard. Step one is get the intake call down. Okay, know who you're talking to, know why they're calling, and know that you have all the decision makers that are going to be at the appointment. Step 2, find emotionally what's most important to the patient.
That's
about
the only
sleep.
way that you can create value.
Yeah.
Have them connect that emotional value, and don't present the financial until you've presented or you've created that value. And then step 3 with the financial is very, very simple. It's just presented in very easily
to say
affordable
yes.
monthly terms.
Yeah. If you take these 3 steps, guys, you will be able to implement sleep dentistry in your practice.
And you too could have a 98%.
If you have any
Check
questions,
us out on YouTube.
Yeah, if you have any questions for us, go to thecrabtreegroup.com. Go to our YouTube page. Subscribe to our YouTube page, please.
Find us on LinkedIn.
Find us
Sean
on
Crabtree,
LinkedIn.
Cameron Bailey. Give us your comments. I mean, we were just trying to give you as much as we could in this quick video because this is such an important topic. Give us your comments. Tell us what you think. Tell us what you've experienced with sleep, some challenges, and we'd be glad to hear from you. Take care.
Talk to you guys soon.